Good afternoon, Senator Brakey, Representative Hymanson, and members of the Committee on Health and Human Services. My name is Chelsea Sesto. I'm a resident of Poland, Maine, and I work in Portland, Maine. I'm currently pursuing my master's degree in social work with the University of Maine, and I have 9 years of experience working in the social services field. I also have firsthand experience working with oppressed populations who are experiencing opioid use disorder. I'm here today to testify in favor of LD 605, an act to support evidence-based treatment for opioid use disorder. As most of us know, opioid use disorder touches many people's lives in our state. However, it's still something that our citizens and legislation are turning a blind eye to frequently. This really wasn't an option for me when I was working for a local agency that serves a population highly affected by heroin and opioid use. This agency had to make a lot of changes to respond to this crisis. They have lights in their bathrooms that will go off after 30 seconds of someone not moving. They've cut bathroom doors. They have weekly practices of their opioid overdose response protocol. So a lot has changed for that agency in response to this crisis. For me, the hardest part of working with this population during this time was having clients come up to me, reach out. They'd be literally begging for treatment, for help. And I would have to look right at them and report to them that there was nothing available for them. There were no resources I could give them. And most of the time, this was due to lack of insurance coverage. So as I work in social services, it is expected that I would be exposed to people experiencing opioid use disorder, and also working with populations that are facing barriers to this treatment. However, I'd like to argue today that most people in our state have been touched by this opioid public health emergency on a personal level. Currently, I'm helping a friend navigate a personal situation with her niece. So her niece, a wonderful human being, has gone from 145 pounds to 106 pounds in less than 6 months. Her body's shutting down. Right now, her life consists of spending all of her money on heroin, which means neglecting her basic needs. She hasn't been able to make her car payment. She's rarely feeding herself. Right now, she does not have an apartment. And this is really just so that she can be well enough to go to work, so that she can continue this cycle. Multiple times a week, she's calling her aunt crying in tears, and she's really desperate for help that nobody can offer her simply because she's uninsured, which is heartbreaking. So her aunt, out of the kindness of her heart and the love for her niece, has spent many hours trying to find different resources for her niece. These are long-term resources where she can be fully supported and given the tools to change her life instead of just going in for a quick detox and being released back into her environment. The cheapest rehab that she's found to date is out of state and more than $15,000. So this has been a really tough journey to navigate for both of them. So it was reported by the Portland Press Herald that 418 people have died by drug overdoses in Maine in 2017. It's also been reported that Maine Emergency Department visits for opioid overdoses jumped 34% since 2018, and it's only April. Although this is referred to as a crisis in our state, historically it's had very little recognition by the state of Maine's Governor Paul LePage. I'm here today because it is time. We need to spring into action to help prevent the devastating loss of lives that we observed last year due to this public health emergency. Despite the 59% citizen vote to expand Medicaid in Maine, there's been no real movement towards implementing this expansion, which is perpetuating the systemic issue of uninsured citizens experiencing opioid use disorder and not being able to access any treatment. So these stories, these facts, this is why I'm here today. I'm here to stand with everyone else who has realized the devastating need that exists just outside all of our front doors. I'm here to urge all of you to pass this very important piece of legislation to allow citizens of Maine to access evidence-based treatment for opioid use disorder without insurance. This is what the state of Maine needs to appropriately address this ever-growing health emergency, and I truly believe that. Now, I know that others in this room have their reasons to urge you not to pass this piece of legislation. I would like to argue that the overlying reason for opposition to this bill can be summed up by one thing, and one thing only, and that is stigma. The stigma placed on people with substance use disorders is one of the biggest barriers to this population accessing treatment. Whether it be an issue of allocation of funds or moral values, I argue that other public health emergencies such as HIV, AIDS, SARS, I argue that they would be addressed in a far quicker time frame than we have seen for the opioid crisis. Some statistics for you. The Center of Disease Control states that in 2013, prescription opioid dependence, abuse, and overdose cost the United States $78.5 billion. It's estimated that lost productivity for people with opioid use disorder in the United States came to a total of $20.4 billion in 2013. In the state of Maine, hundreds of people are turned away from treatment due to lack of insurance. These same people who are not offered help are continuing to use, overdose, and this is also leading to the high amount of emergency department visits, which are also very, very costly to our state. If you find yourself being motivated by the cost of things, I think that these numbers also show that it's time to do something. So, thank you for listening. I am here putting my full confidence in you and urging you to support LD 605. Please help those who desperately need and want effective treatment to access it. In the words of a man that I admire and who has done so much for the community of Portland, Maine, Joe Chrysler, I am a human being. Part of my job, part of being alive, is making sure that other people are too. Your support will ensure that many people are able to do just that, stay alive, live meaningful and healthy lives. Thank you for your time and consideration.